Hello and welcome. On behalf of myself, Lesley Hansen, and Mark Bearden, we have served as project managers of the EpicMyChart implementation, and we welcome you to this final wrap-up meeting. Today we will walk you through the description of the project, the target MOV, the requirements, budget, schedule, the shifts in schedule and scope, quality measures, beta test results, outstanding items, and lastly, a project documentation list that you can expect to have with you once we wrap up. So let's get started. The project has been described as such. Diagnostic imaging associates needed to implement Epic's MyChart module into their IT infrastructure. The outcome goal is to allow diagnostics imaging patients to check and update their own respective records independently and at will, download their diagnosis, images, and test results in a secure and private domain and manner. In addition, the capability to communicate with their doctors via secure messaging is desired as well, and vice versa, that a provider could thus respond to such messaging. And the web portal has a deadline of execution of 8 weeks from the authorization date that is listed on our statement of work. The project's overall goal and measure of value and measures of success is that the technology will enhance patient-provider communication, which will be measured by reducing safety and quality communication errors by 5% from implementation date benchmarked to 6 months before. The technology will also be deemed successful if patient engagement satisfaction metrics of diagnostic imaging improve by 5 points within 3 months of implementation. And lastly, the technology is going to be deemed successful to the organization if the provider relations are improved by measuring waste time of coordination of care through a productivity measure of 25% increase within 9 months of implementation. These MOV project targets will show up again when we discuss the beta testing we did, which was where we tested the technologies and capabilities to meet these expectations before we wrapped up the project. Requirements. In addition to the previously mentioned targets, the technology was expected to meet the following requirements. The requirements of the technology are as follows: that it shall require users to change their password every 6 weeks. It will prompt them on automatic. They won't even have to think about it. So it's a safety measure, it's a PHI measure, it's an ongoing reassurance of security and safety. It shall allow providers to view all diagnostic images and lab work results. It shall allow patients to securely message their correct provider, and that's a key word, their correct provider. It shall allow providers to securely respond to the message from patients, so that the messaging portal is a two-way street. It shall allow patients to make, modify, and cancel appointments with their provider. It shall allow providers to e-scribe medications to the patient's designated pharmacy of choice, automatically e-scribe, making it seamless and easy for the patient. It shall allow patients to securely download their respective healthcare information securely and confidently. And it shall allow providers and other providers within the designated realm noted by diagnostic imaging to communicate. So not only is it intended to be a patient-to-provider communication tool, but it will allow internal providers, and that scope of providers is going to be designated by diagnostic imaging of who can talk to who. So scope. The scope of the project is to install the EpicMyChart software and the respective hardware to the diagnostic imaging IT infrastructure, test for security and PHI protection, ensure seamless handoff from HIT pros to Epic support after implementation for support after our project has wrapped up. And the budget for this project was set at $560,000 with a margin of error, give or take, for 25%. The backbone of a project planning is the schedule. This was our high-level schedule that we've been sharing with you and your team for the last 8 weeks. There have been some ad hoc check-ins here and there, but the structured schedule is shown here. From October 30th to the 17th of November, we had our R&D period, our research and development. We had a check-in on 11/18 scheduled. On 11/19, we began prep for the implementation outline. And on 11/20, implementation began. On 11/30, the check-in on the implementation progress was scheduled. On the 11th of December, the recommendation assessment for continuing success post-implementation was scheduled. And on 12/14, present recommendations for post-implementation success. So quality assurance and control. The quality assurance and control framework of this project really depended on documentation and beta testing. We've shared with you several project management tools such as the project charter, the stakeholder registry, 2 status reports to ensure that we are always connecting with you on the progress of the project. Additionally, through beta testing and IT framework monitoring, we've been able to implement real-life testing to raise up any bumps in the road and address those proactively. This allows us to confidently wrap up the project knowing that you're left with a product that will meet your stated expectations. So here are some quality objectives that we've laid out and their requirements, and this should look familiar to you. We proactively monitored and tested beta to prevent defects and verify that the system is meeting expectations that were outlined in the project charter. The quality assurance process includes documentation from the process-oriented communication plan that's been presented both biweekly and in monthly meetings and has also had minutes provided for verification. The quality control process has included beta testing and monitoring of technical frameworks of secure messaging between patients and provider, provider to patient, and provider to provider. The beta has also included secure login success with a 6-week automated prompt of password reboot. The ability in the beta to securely download healthcare information is also tested, as well as the eScribe capabilities as well. And our test data was stored at our headquarters in Schaumburg, Illinois. So every project has, where we start the scope, but then there also occurs changes and when we need to ask for change requests. So this shows the original scope and then the history of approved changes that we have documented with you. The original scope was to install EpicMyChart software and hardware, test for security of PHI protection, coach and train the unit managers, and then properly hand off to Epic for support after the implementation. And then the history of the approved changes that we issued was the approval to delay the go-live date 2 days from December 12th to December 14th. Additionally, the original budget versus the actual cost of completing the project, the original budget was $579,200. The actual cost of completing the project has come out to $546,000. So although we've been about 2 days behind, we are under budget. And here's a summary of the test plans and results that we've done through the beta. In test mode, we have selected clinic employees to enter their data and retrieve as if they were the patient. This feature substantially increased the patient involvement that the patients were enabled and empowered to easily and smoothly transfer, upload images, and documents from outside sources. This was deemed as successful. Monitor EpicMyChart and diagnostics imaging in a live environment. To test this, we allowed a small number of patients, roughly 20, who signed a privacy waiver, and they viewed and utilized the entire system. They rated their satisfaction with ease after doing so. That satisfaction rate was recorded as 95%, which we deemed successful. We conducted a stakeholder satisfaction meeting, which you all may remember. We measured the stakeholder satisfaction through a SurveyMonkey tool, and the total average score ranked into totally satisfied. So we deem that as successful. So although we're about to wrap up, the majority of our outstanding issues are around the handoff to Epic tech support. The others you'll see here are some just-in-case double-checking checkpoints that we had to issue change requests for in order to extend the timeline a little bit. And so we want to complete an internet security review. The system is crashed or the system locking up due to overload. So we just want to take a double look at that. But the majority of these are just the handoff off to Epic once we depart from the project planning. And although our project team may be about to wrap up, we're leaving you with several documents that can be categorized into 4 buckets: system documentation, user manuals, training materials, and maintenance documentation. And this chart, which we'll leave with you, fully outlines the contents of such documents and who they are intended for. And it's with that we wrap up. We thank you for your partnership, your collaboration, and your patience. We are excited to see the value that EpicMyChart will bring to your organization, and we depart with knowing that you are in good hands with the IT support folks over at Epic. Thank you again.